Emergencies don't wait, and knowing how to act fast can save a life. Whether it's a sudden cardiac arrest or someone struggling to breathe, CPR and AED use are critical skills everyone should know. Today, we'll break down life-saving interventions for adults, children, and infants, because in a crisis, every second counts. Recognizing cardiac arrest. The first and most important step in any life-saving intervention is recognizing when someone is experiencing cardiac arrest. Cardiac arrest occurs when the heart suddenly stops beating, leading to an immediate loss of consciousness and the cessation of normal breathing. A person in cardiac arrest may collapse without warning, become unresponsive, and will not be breathing or will only be gasping for air. This situation is extremely time-sensitive because, without immediate intervention, brain damage can begin within 4 to 6 minutes due to the lack of oxygen supply. If cardiac arrest goes untreated for more than 10 minutes, survival chances decrease dramatically. For adults and children, the first step in assessing cardiac arrest is checking for responsiveness. The rescuer should approach the person, tap their shoulders firmly, and loudly ask if they are okay. If there is no response, the next step is to check for normal breathing by looking for visible chest movement, listening for breath sounds, and feeling for airflow from the person's mouth and nose. If the person is not breathing at all or is only gasping for air, cardiac arrest should be suspected. It is important to note that agonal gasps, which are irregular, shallow gasps, do not count as normal breathing and indicate that the person needs immediate intervention. For infants, the approach is slightly different due to their delicate bodies. Instead of tapping the shoulders, the rescuer should gently tap the sole of the foot while calling the baby's name in a loud but reassuring tone. If the infant does not respond, appears limp, and is not breathing or is only gasping, it is a sign of cardiac arrest. Infants have smaller airways and are more prone to breathing difficulties, making it critical to act without hesitation. Once cardiac arrest is identified, immediate steps must be taken to save the person's life. Calling emergency services immediately. Once cardiac arrest is recognized, emergency medical services, EMS, must be contacted immediately. The sooner professional medical help arrives, the higher the chances of survival. If there are multiple bystanders, one person should be assigned to call emergency services while another begins CPR. If the rescuer is alone, they should call for help before starting chest compressions. However, in cases involving infants and children, a different approach is recommended. Cardiac arrest in young children is often due to respiratory failure rather than heart problems, so providing immediate CPR can be more beneficial. In such cases, the rescuer should perform 2 minutes of CPR before calling emergency services, as immediate chest compressions and rescue breaths can help restore circulation and oxygen flow. After 2 minutes, the rescuer should call for help, even if they are alone. When calling emergency services, the rescuer should clearly provide details about the situation, including the person's age, condition, and whether CPR is being performed. If an automated external defibrillator, AED, is available nearby, the caller should mention this so that the dispatcher can provide instructions on using it. The emergency dispatcher may also provide step-by-step CPR guidance, which can be helpful for individuals who are not trained in CPR. Performing high-quality chest compressions for adults. Chest compressions are the most critical component of CPR and play a vital role in maintaining circulation when the heart has stopped beating. Chest compressions mimic the pumping action of the heart, helping to push oxygenated blood to the brain and other vital organs. For adults, the rescuer should begin by positioning themselves next to the person on a firm surface. Kneeling beside them, the rescuer should locate the correct hand placement by identifying the lower half of the sternum, breastbone. The heel of one hand should be placed in the center of the chest, with the second hand placed on top of the first, fingers interlocked. It is essential to ensure that only the heel of the bottom hand applies pressure while keeping the fingers off the chest. The rescuer should avoid unnecessary interruptions and continue compressions without pause, except when providing rescue breaths if trained to do so. If multiple rescuers are present, they should switch roles every 2 minutes to prevent fatigue while maintaining high-quality compressions. If an AED becomes available, it should be used as soon as possible, but CPR should not be delayed while waiting for it. Adjusting chest compressions for children. Performing chest compressions on children requires modifications to account for their smaller and more flexible rib cages. The goal is still to maintain effective blood circulation, but excessive force should be avoided to prevent injury. For children aged 1 to 8 years old, the rescuer should begin by placing one hand in the center of the chest, just as in adult CPR. However, unlike adults, using 2 hands is not always necessary unless the child is larger and requires more force. If the child is small, the rescuer should use only one hand, applying gentle but firm pressure. Compressions should be approximately 2 inches deep, maintaining the same rhythm of 100 to 120 compressions per minute. Full chest recoil between compressions is just as essential in children as in adults, allowing the heart to refill with blood properly. The rescuer must strike a balance between applying enough force to create effective circulation and avoiding excessive pressure that could cause rib fractures. If the rescuer is unsure about the amount of force required, they should focus on delivering firm, rhythmic compressions while monitoring the child's response. If an AED is available, pediatric pads should be used if possible. If pediatric pads are not available, adult pads can be used, but one pad should be placed on the child's chest and the other on their back to avoid overlap. Ensuring that CPR is performed correctly on children can significantly improve survival rates. Since children often experience cardiac arrest due to breathing issues rather than heart problems, immediate action is critical. If the rescuer is alone, 2 minutes of CPR should be performed before calling emergency services to maximize the child's chances of survival. By following these steps, rescuers can provide effective chest compressions for adults, children, and infants, helping to maintain blood circulation and improve the likelihood of survival until professional medical help arrives. Using the correct CPR technique for infants. Infants require a much gentler approach when performing CPR due to their small size and delicate chest structures. The goal of infant CPR is to maintain blood circulation while minimizing the risk of injury. Unlike adults and older children, whose chest can withstand more pressure, infants' rib cages are more flexible and can be easily damaged if compressions are too forceful. The recommended compression rate remains between 100 and 120 compressions per minute, maintaining a steady rhythm to ensure continuous blood circulation. Since infants are particularly vulnerable to oxygen deprivation, beginning CPR immediately is critical. If the rescuer is alone, they should perform 2 minutes of CPR before calling emergency services. In many cases, infant cardiac arrest results from respiratory failure rather than direct heart issues, making quick intervention essential. By acting swiftly and using the correct technique, rescuers can improve an infant's chances of survival before professional medical assistance arrives. Providing rescue breaths in CPR. Rescue breaths are a crucial component of CPR because they deliver oxygen directly to the lungs, helping maintain vital organ function. While chest compressions alone can temporarily circulate oxygenated blood, rescue breaths provide fresh oxygen, increasing the effectiveness of CPR. The combination of chest compressions and rescue breaths is known as conventional CPR and is the most effective method for most cases of cardiac arrest, especially those caused by respiratory failure. The proper ratio for CPR is 30 chest compressions followed by 2 rescue breaths. For adults and children, the rescuer should use the head tilt, chin lift maneuver to open the airway. This involves placing one hand on the person's forehead and gently tilting the head back while using the other hand to lift the chin. This position helps prevent the tongue from blocking the airway. Before delivering a breath, the rescuer should ensure that the airway is clear of any obstructions, such as food or fluid. Once the airway is open, the rescuer should pinch the victim's nose shut, seal their own mouth over the victim's mouth, and deliver a slow 1-second breath. The chest should visibly rise, indicating that air has entered the lungs. If the chest does not rise, the rescuer should reposition the head and try again. Proper ventilation is key because inadequate rescue breaths can limit oxygen delivery and reduce survival chances. For infants, the rescue breathing technique is slightly different. Instead of sealing only the mouth, the rescuer should cover both the nose and mouth with their own, ensuring an airtight seal. Since infants' lungs are much smaller, gentle puffs of air should be given instead of full breaths. Each breath should be just enough to make the chest visibly rise. Overinflating an infant's lungs can be harmful, so controlled small breaths are essential. If the infant does not respond after 2 breaths, the rescuer should resume chest compressions immediately. If the rescuer is untrained or uncomfortable providing rescue breaths, hands-only CPR, which involves continuous chest compressions without rescue breaths, is still an effective alternative. Studies have shown that hands-only CPR can still improve survival rates, especially for adult victims of sudden cardiac arrest. However, for infants and children, where respiratory failure is a common cause of cardiac arrest, rescue breaths are highly recommended whenever possible. Using an automated external defibrillator, AED, properly. An automated external defibrillator, AED, is a portable device that can analyze heart rhythms and deliver an electric shock if needed to restore a normal heartbeat. AEDs are designed to be used by both trained professionals and untrained bystanders, making them a crucial tool in saving lives during cardiac arrest. When used early, an AED can significantly improve survival rates by restoring a normal heart rhythm before irreversible brain damage occurs. Once the pads are in place, the AED will analyze the person's heart rhythm to determine if a shock is needed. If a shock is advised, the rescuer must ensure that no one is touching the person before pressing the shock button. The AED will then deliver an electric shock to try to restart the heart. After the shock is delivered, the rescuer should resume CPR immediately, beginning with chest compressions. If the AED does not recommend a shock, CPR should continue without interruption. For children and infants, AED use is also effective, but requires special considerations. Pediatric pads should be used whenever available, as they deliver a lower energy shock that is safer for smaller bodies. If pediatric pads are not available, adult pads can still be used, but they should be placed differently, one pad on the chest and the other on the back, rather than both on the front. This positioning prevents the electrical current from traveling through too small of a surface area, ensuring a more effective shock. Continuing CPR and AED use until help arrives. CPR and AED use should continue uninterrupted until professional medical responders arrive or the person shows signs of life, such as breathing, coughing, or movement. If the victim regains normal breathing but remains unconscious, they should be placed in the recovery position to keep the airway open and prevent choking. However, even if they appear to be improving, they must be monitored closely until emergency medical personnel take over. If an AED is available, it should be used as often as directed by the device. Most AEDs will reassess the heart rhythm every 2 minutes and determine whether another shock is needed. The rescuer should follow the prompts carefully, continuing CPR between shocks to maximize survival chances. The combination of effective CPR and early AED use dramatically increases survival rates in cases of sudden cardiac arrest. Studies have shown that when an AED is used within the first 3 minutes of collapse, survival rates can be as high as 70%. This highlights the importance of widespread AED availability and proper CPR training. By mastering these 8 life-saving interventions, recognizing cardiac arrest, calling for emergency help, performing high-quality chest compressions for adults, adjusting CPR techniques for children and infants, providing effective rescue breaths, using an AED properly, and continuing CPR and AED use until help arrives, anyone can play a critical role in saving lives, whether in a home, workplace, or public setting. Having the knowledge and confidence to perform CPR and use an AED can make the difference between life and death in an emergency situation. CPR and AED training can mean the difference between life and death. Whether for adults, children, or infants, knowing these techniques can help you step up when it matters most. Stay informed, get certified, and be prepared to save a life. If this was helpful, like, subscribe, and share to spread awareness.